I'm going to introduce Dr. Tiller now, and he's going to provide us with his remarks.
Thank you, Dr. Lewis. My name is Dr. Sean Tiller. I'm the Chief of Emergency Services at James Peyton Memorial Hospital in Gander. Born in James Peyton Hospital, raised in Lewisport. So I'm a homegrown MUN graduate. What I'm going to speak to is typical, I think, of the rural emergency departments in Newfoundland. My area of knowledge is only in the Central Health region, but I would suspect that the issues that we deal with are no different than issues in any other rural emergency departments on the island part of the province. Our department is staffed by 3 full-time emergency physicians and 2 part-time emergency physicians. So we have to provide 24-hour-a-day, 7-day-a-week coverage with 5 physicians. Our coverage area extends from Lewisport to Terra Nova. It's a fairly large geographic area. The issues of recruitment and retainment of primary care physicians in rural Newfoundland, it impacts our emergency departments in a significant way. The entire Kittiwake Coast, which stretches from Gander Bay to Gambo, is serviced almost entirely by part-time practices, which means a physician will be in a clinic 1 or 2 days a week, with the exception of the hospital in New West Valley. That means that the majority of the patients in our catchment area don't have access to primary care practice when they need it. They may be able to have an appointment to see a doctor next week, or maybe 3 weeks, maybe 4 weeks down the road. That's a typical scenario. The town of Gander itself has done well within the past year, being able to recruit some new physicians. That's been a significant benefit, but unfortunately, it still goes it still goes a long way to meeting the requirements. The large patient population in Central Health have to rely on the emergency department not only for their emergency conditions, but also for their non-emergent conditions for a significant amount of time. That means the emergency room physician, which is solo, has to juggle the immediate requirements of the emergency care, which we all had to provide, and the vast volumes of patients that are requiring the non-emergent services. And that's unfortunately why there's long wait times in a lot of our emergency departments, because of the lack of rural physicians in these satellite clinics or these outport clinics. So the emergency room physicians have to rely on that as well. Being able to provide a competitive wage to bring more rural physicians to Newfoundland would go a long way, and to be able to reduce wait times in our emergency departments. It's it's not a direct impact, but it's definitely a significant impact. The second issue that I wanted to discuss was the inability of rural emergency physicians and emergency departments to be able to recruit well-trained, Canadian-trained emergency room physicians to rural Newfoundland. Our department of 5, 3 full-time, 2 part-time physicians, has had a turnover of 3 physicians within the past 3 years. We lost 2 physicians to Ontario and 1 physician to Alberta. And we were only able to replace these physicians with international medical graduates, which were provisionally licensed, and so were only able to be licensed in Newfoundland, so they weren't able to practice in other parts of Canada. So we're a long way off from being able to find highly qualified physicians who are Canadian graduates or Canadian trained physicians to be able to work in these departments. And unfortunately, because we may be able to have our emergency rooms staffed with locum physicians and physicians from international medical schools, the emergency departments in rural Newfoundland still require highly trained, specialized providers, because we are the first line for a large proportion of the population of this province. It's a bit of a double standard that highly trained emergency room physicians are accessible to patients on the Avalon Peninsula, but you have to rely on physicians that don't have emergency room specific training for the rural part of the province. Unfortunately, I think that's a double standard that I think we need to try to address with being able to offer a competitive wage for these physicians. The third point, which I'd like to make as well, is because of these requirements for emergency room physicians to have highly technical skills and to provide special emergency care in rural Newfoundland, it's significantly onerous on we as rural physicians to be able to access the type of medical education that's required to meet these standards. The standard of care for emergency room physicians, it doesn't make a difference if you live in Corner Brook or Grand Falls or Bay-Largent or Torbay. It doesn't make a difference. The standard of care for emergency care is the same. So we as emergency room physicians need to be able to access these highly specialized technical courses and training, and it's significantly financially onerous on us to do that. The travel requirements make it necessary that we have to leave the province to do these courses. And unfortunately, those types of training classes and courses aren't compensatable by any amount of compensation that we have now. So that is a significant financial burden on the emergency room physicians. So we'd like to be able to provide the cutting edge in medical care in rural Newfoundland. We'd like to have the staff to be able to do so, but it's difficult for us to try to maintain that given the current level of physician compensation that we have. We're not asking for something that's through the roof or to the moon. We're not asking for that. We're just asking to be able to move up a couple rungs on the ladder so we can look at other physicians in this country, look them square in the eye and say, you know, this is a fantastic province to come to work in. You've seen the wonderful ads on television. It's a beautiful province. It's a wonderful place to live, and we can offer you a good wage to come and work here. And unfortunately, that's not the case right now. So that's that I think is the majority of the concerns that I wish to bring up today. Thank you.
Thank you, Dr. Tiller. And the point you're making certainly is that we have to be competitive in order to compete with the rest of Canada for physicians to work in Newfoundland and Labrador.